Good evening, all. Today's my topic is Unveiling the Hidden Mystery Behind Oculomotor Nerve Palsy. So, the introduction is cavernous sinus meningiomas are a diverse group of meningiomas occurring in and around cavernous sinus. These primarily in the cavernous sinus or involve the cavernous sinus secondarily. Patient harboring cavernous sinus tumors most frequently present with oculomotor deficits as cranial nerves 3, 4, 6 passes through the cavernous sinus. Herein we highlight the presentation of cavernous sinus tumor with isolated third nerve palsy. Here, a case of 55-year-old female presented with complaints of double vision and drooping of right upper lid for past 3 months. History of gradual drooping of right upper lid with a history of defective vision in right eye, and she is a known case of diabetic for past 2 years and no history of trauma or head injury. On her oblique examination, her both eye corrected visual acuity was 6/12, and on right eye lid shows ptosis with anterior chamber normal depth and iris color pattern normal, and pupil is 4 mm dilated, non-reacting to both direct and consensual light reflex. Lens shows immature cataract, and EOM was restricted in adduction, elevation, and depression, whereas the left eye oblique was completely normal, and the pupil was reacting to both direct and consensual light reflex. Here is the picture of the patient showing the restriction of the eye movement in adduction, depression, and elevation. On diplopia charting, maximum separation of crossed images in levo version, levo elevation, and levo depression, that is suggestive of right third nerve palsy. Wirtz 4-dot test showed crossed diplopia showing the 5 images, and both eye fundus shows disc and vessels normal, and both eye macula appears to be normal with foveal reflex plus. Another cranial nerve examination was normal, and the impression was right eye pupil involving isolated third nerve palsy. On further MRI imaging, there was a well-defined circumscribed extraaxial mass centered on the right cavernous sinus, extending to orbital apex with a bone hyperastosis. It was a feature suggestive of right cavernous sinus meningioma, and patient was admitted in neurosurgery department for the excision of the tumor. Here is a picture showing a tumor in the cavernous sinus, which was suggestive of cavernous sinus meningioma. Now moving on to the discussion, cavernous sinus meningioma is the most common primary cavernous sinus lesions. These are technically difficult to resect because they tend to invade vital neurovascular structures within the cavernous sinus. These are the benign tumors that involve the cranial nerves, and in general, pupil involving isolated third nerve palsy prompt an ophthalmologist to suspect compressive lesions at basilar level. But rare presentations like cavernous sinus meningiomas should be considered as differential diagnosis. Thank you.
Did the patient undergo any surgery?
Yeah, ma'am, I have suggested, but because of a neurosurgical risk, a patient denied surgery, ma'am.
Okay.
Is there radiation therapy or EBRT or something else can be then offered in that case?
Yeah, we discussed with the neurosurgeon, sir, but they said even after that, patient, because of the vital structures, there will be further complications and there will be increased ICT, and they have explained everything, sir, so patient denied for it.
So refuse consent.
Yeah.
So what do we learn from this case then, basically?
Yeah, mostly because of cavernous sinus lesions, it may involve all the nerves. So mostly it was present first with because of the inside of the cavernous sinus, the sixth nerve is the most commonly affected because it is in the substance. But here is the presentation with the isolated third nerve palsy, which may lead to the further imaging, and then we came to know that it was a cavernous sinus meningioma. So on further, if the patient didn't come for follow-up, so on further follow-up we may have some idea whether it's involving other nerves. So
imaging was done because you're suspecting an aneurysm or something else at that time.
Yes,
primarily isolated
yes,
third nerve.
yes, sir.
This location is the same again.
Yeah,
so
yes, sir.
again would be in that.
Yes, sir. So we have to have a DD of this also.